So treating lipedema is a fairly individualized thing, and there are a number of different ways to do it. You hear people talking about water-assisted liposuction, you hear people talking about power-assisted liposuction, laser-assisted liposuction. The technique that I typically use is tumescent and power-assisted liposuction. What does that mean? Well, depending on the stage of lipedema, we make a plan together on how aggressive we're going to be. I like to treat at least one half of the body at a time in terms of the legs. So I like to do from the waist to the ankles on the whole front. Sometimes we can even go all the way around, and then at a second surgery we'll come back and do from the buttocks to the ankles. We put in a tumescent solution, which is a solution that helps minimize blood loss, and then we use power-assisted liposuction, which is a vibrating cannula. Cannulas are like this. This is a liposuction cannula, this is a 5mm cannula. And then we use that cannula to break up the lipedema, which is usually very dense. It's not like normal fat. It's definitely very sticky, frequently very pale. It's almost more like tofu than normal fat is. So it has to be broken up and separated. And then we aspirate as much as we can, and then the fun really begins. And I use my hands, and we find the lipedema nodules that are left behind, and I break them up by hand, and then we also express as much of that material out of the incisions as we can also. That process also smooths your result, so you get the finest overall outcome. Then sometimes I'll go back in and we'll take the cannula vibrating off of suction, we'll break things up a little bit more and make a fine slurry of the remaining lipedema and fat in the area. And that really gives you a nice smooth result, minimizes dense divots, and helps encourage a little bit more skin contraction. After all that's done, then we'll get you in your compression garment, and frequently I'll put in a drain, and that makes it so that you don't have bloody fluid leaking out of multiple holes in your legs for the next few days.
Hi everyone, my name is Leanne. I am a surgical coordinator here at Larson Plastic Surgery. Today I wanted to talk to you about the process of scheduling your consultation and your procedure with us. We want this to be so smooth and easy and really stress-free. We want to take the best care of you possible from the beginning till the end and for a lifetime. Being a patient here, you become our family. During your consultation, in person or virtual, Dr. Larson will give you a customized approach. He is going to make sure that we can meet and exceed your expectations for the procedure you are interested in. After that is finalized and we have our plan, you and I will move forward from there to make this a smooth and flawless journey for you.
Hi, my name is Felicia. I am back office clinical manager and insurance specialist for Larson Plastic Surgery. I wanted to touch base on a little bit about insurance versus self-pay for lipedema. First, insurance, if we go through, there's a lot of stipulations and a lot of processing that goes with it. First of all, you have a 90-day global period. Once the authorization is processed, again, authorization is not guarantee of coverage, and we don't know that until it's billed and deemed to be a medical necessity. Second, being able to process everything and give you everything that you need, from garments to global care is unlimited, and to be able to give you drain removal without even having to deal with the insurance. Through insurance, it is a 90-day global period, which we only could include office visit. Anything other will have to be billed out to insurance. Therefore, we have those capabilities if you were to be self-pay. Self-pay gives us the ability to give you a discounted rate with the hospital and the anesthesia. If you were to go through insurance, we are unable to do that. We only are able to process through physician only, and we don't have any capability of providing you the necessary stuff that you need to heal accordingly. With that, we are able to self-pay, provide you with your garments, your DVT pumps, your Juzos for healing, and all of your follow-up appointments.
Dr. Larson is nationally recognized as an expert in lipedema and one of the top plastic surgeons in the world. We have patients that travel from all over for this procedure. We want to make sure that you know you are in the best hands with Dr. Larson. Dr. Larson takes the time to speak with you and really help you understand the plan and what it's going to take, short-term, long-term, goals to set in the office and at home. We want to hold your hand through this and make sure that it is an easy, smooth, fun process for you.